Thank you very much also for the opportunity. You got a little feel from the video earlier about the games that the Gaelic Athletic Association have responsibility for. And as our MEP, Sean Kelly, who has just had to leave for another meeting, pointed out, they are Indigenous Games, and he was part of a committee here for greater recognition for Indigenous European Games. We are new to the Sports Clubs for Health. We were not involved in the first iteration, and even the term HEPA is quite new. It's not part of the Irish sporting parlance. So when we've begun our journey with the Sports Clubs for Health, if you look at page 27 of the booklet on the approaches that associations can take, the GAA took a combination of Type 3 and Type 4, which is to develop specific Sports Clubs for Health strategies at a national level, and then to develop some specific initiatives within that strategy. The Gaelic Athletic Association is the largest sporting and community association in Ireland. We have 1,600 clubs dotted right across the country. We follow a parish boundary, so every parish in the country has a Gaelic Athletic Association club, a GAA club. Some of them deliver Gaelic football, hurling, handball, rounders, camogie, and ladies football, or a variation of all of them together. They are primarily a high contact sport. So when we reach the end of our playing career, around the age of 35 or so, the possibility to continue in the specific sport is quite limited because of the continued risk of injury. So through our journey and our learning experience from our participation in Sports Clubs for Health, we are very much looking to develop adapted versions of our games now to live up to our value of providing lifelong participation within the association through our games. We also have an international dimension, and as many of you will know, the Irish travel quite well and quite frequently, and have done since our Great Famine in the 1800s. And we bring our games with us and our culture. And we have over 400 GAA clubs scattered on all the continents of the earth at the moment. Within our values, we look at ourselves as being much more than a sporting association. We inhabit a space somewhere between a sporting association and a community organisation. We are responsible for the largest number of volunteers in Ireland. We have a population of approximately 600,000 members and a playing population of 160,000. To give you an idea of our reach, our Cool camps, which target 5 to 12-year-olds and runs for a week each summer, last year had 127,000 participants, and that's 1/4 of all young people that age in Ireland. So, as I said, the GAA inhabits this kind of a special place, and that left us well predisposed to taking on the challenge of delivering health-enhancing physical activity, but also looking at our GAA clubs, because they exist in every parish, as a potential setting to deliver health promotion, not just through our games, but in the wider concept of health promotion as promoted by the World Health Organization. I think it was important for us to give some justification to this here work, and one of our councils, Ireland, is split into 4 provinces: Ulster, Munster, Leinster and Connacht, and our southern province, from where MEP Sean Kelly is from, conducted some research with parents who were delivering their young people to those cool camps and to the GAA clubs. And they asked, why did you choose the GAA for your children? As you can see, the first 5 responses were directly related to health or youth personal development. The first time skills associated with our games was mentioned was number 6. So this is a slide that I show to our coaches quite a lot to remind them of why parents are choosing sport. Now, if you ask children why they were choosing sport, the research shows it's to make friends and to win and to enjoy sport and to develop skills. But for the parents within the GAA, the first 5 reasons were directly related to how the GAA and sport could support the health of their children. So in 2006, we started a formal relationship with the Health Service Executive in Ireland, which is the implementation arm of the Department of Health. And we rolled out a drug and alcohol education programme through our network of clubs. However, in 2012, we realised that this narrow focus wasn't responding adequately to all the needs of our members or the demand from our clubs and our communities. So we sat down with the Department of Health, the Health Service Executive. The Public Health Agency is the implementation body for the department in Northern Ireland. Our association is a 32-county association, so we cross 2 political jurisdictions. Ireland, Republic of Ireland and Northern Ireland. And we developed a model which is the GAA Healthy Club model. And within the Sports Clubs for Health, it is taking very much the settings approach, looking at the sports club as a setting and how we can enhance the experience of all members, not just the playing members, but all members who come in contact with our clubs and ensure that their experience is a health-enhancing one. We begun in 2013 and we worked closely with my colleague here, Dr. Aoife Lane, who is Head of Sport in Athlone IT, as the evaluation team for the project. We began with a very small number, just 18 clubs, 16 participants and 2 mentoring clubs, and we stringently evaluated how this here model worked for them. Similar to what Erica was saying, there was no compulsion for these clubs to be involved. We had an open expression of interest and actually had 50 of our clubs request to be involved in the pilot. It lasted for 2 years and it involved a combination of us offering programs that could enhance health, devised at a national level, with the clubs themselves going out to their members and their playing population and their wider community, asking, what would you like to see us as a sports club do to support the health of this community? Fast forward 2 years and Aoife and her team produced the evaluation report, which encouraged us to move into phase 2 once we implemented the recommendations. We have now grown to 60 clubs. It remains a test phase for us. And I'll look at what some of the clubs are doing in a moment. But as we transition from phase 1 to phase 2, and this was a great incentive for us obviously to continue, but also to encourage possibly other sporting associations to take up the task of sports clubs for health, we were able to come to an agreement with Irish Life, which is a large pension firm in Ireland, to come on board as corporate social responsibility partners. And they are now supporting the growth of the Healthy Club project for 3 years to the tune of €1 million. So from phase 1 moving into phase 2 of the clubs that were participating, these were the key findings for us as an association that we could bring back to our management committee to encourage them to further provide the necessary resources and personnel to grow the Healthy Club project. So the participating clubs increased, they recorded an increase in membership of approximately 10%. Of their non-playing members. They broadened their membership and their volunteer base, and I think for all sports clubs this is a very important factor. People talk about player burnout quite a lot, but I think volunteer burnout is as real an issue for all sports clubs. And for the GAA, one of the big factors here was we saw a large increase in female volunteers, who have now, some of them, started to transition even into the coaching volunteers positions within those clubs, which was it wasn't expected but very, very welcome. Like many long-standing European institutions, we can be quite male-orientated, so it's a good thing for our association, this perspective. As I said, we already attracted new commercial partner at national level, but a number of our clubs at grassroots level also saw that local businesses who did not see perhaps sport as being their thing, saw health as very much something they wanted to be associated with and made themselves available as sponsors. It increased goodwill in the community enormously towards the clubs. Yes, there was some initial costs involved, and we are lucky now with our CSR partnership that we can provide a small grant to the clubs that are in this here project. But even for those that had an initial cost, some have seen increased income as a result also of broadening the programs and activities that they are offering. So again, we use really the four-step approach that is recommended within the Sports Clubs for Health booklet. We did change some of the terminology to best suit our own audience, and I think that's a healthy thing for each government association to do, to make sure that the language of how you're introducing this fits your audience. So we went with plan. We stressed the importance of partners because we think that this here is not just the task of the sporting associations to improve health, but of all stakeholders within communities and society. We looked then for them to focus on what is the activity that is required within their particular club and community, and then we asked them to assess how this has impacted positively their club, both in terms of physically and environmentally, but also very much the culture of the club as well. So this is now our reach for phase 2. As I said, Aoife and her team will present for us the final evaluation. Data collection concludes towards the end of September with the report due at the end of this year. And our intention then is in early 2018 to grow the Healthy Club project and once more make it available to any interested club of our 1,600 clubs in Ireland. The priority areas that the clubs have been working on range across physical activity, gambling, alcohol and drug education, mental fitness or emotional well-being, community development, and that there is primarily reaching out and engaging older members of their communities and ensuring they see their club as an age-friendly club. Healthy eating has been very, very popular. Personal development and furthering the skills of our coaches and volunteers. And an unexpected one that the clubs focused on, but again very welcome, was becoming completely smoke-free campuses and ensuring that there was no smoking allowed anywhere on the club venue or premises. So I'll run quickly through just the recipes for success. Is our healthy eating program, and it was developed in partnership with the Home Economics Teacher Training College in Ireland, St Angela's. It provides, as well as developing a physical resource containing recipes that support both performance and health, and that were developed by leading athletes and nutritionists. Interestingly, it also offers a practical workshop outlet where we focused on minors, under 18s and under 21 players, but they, in partnership with their local school, would then attend the school for a 2-hour cookery demonstration with their home economics teacher. But the interesting thing was what they were cooking, and the hook for the young players was the recipes were all designed to ensure that they would enhance performance as well as promote healthy eating. So this is the example of just some of our clubs. Almost half of them now have gone smoke-free, and our national stadium, Croke Park, which is the 3rd largest in Europe with a capacity of 83,200, will go smoke-free as part of our annual theme day in August. One of the gaps that we had was physical activity for our players who, when they reach the end of their playing career. And again, we are working with the health service executive to introduce this here evidence-based physical activity intervention amongst our clubs. We try to use the entire association as a vehicle for communicating positive health messages. And the Department of Health developed a Little Things Emotional Wellbeing campaign in 2016. We promoted it at one of our full house All-Ireland semi-final matches. And the analysis of that partnership with the HSE showed that it had a reach of over 1 million on social media and traditional media. For us as an association, it has been a great learning curve. It has also brought many unexpected benefits, including the development of dedicated health and wellbeing structures within the GAA, including a National Health and Wellbeing Committee, one in each of the 4 provinces and one in each of the 32 counties. And as I said, the partnership element of it is something that we reinforce constantly, and the partnerships range from third-level institutions to local charities to community groups to schools to other sporting organisations. And as I said, our plan for phase 3 will bring us up. Hopefully, our target is 150 clubs starting early in 2018. And that is, as I said, every club in Ireland is our eventual goal. So we'll take it one step at a time, as Erica said as well. I think it's important not to be jump too far into any of these here initiatives and programs without testing as you go. This here just gives an indication of the type of interest that already exists in the clubs that are not participating. We provided 4 provincial road shows over the last 2 months that reached an additional 500 members and 200 clubs that were coming along to find out more about the Sports Clubs for Health approach and the Healthy Club project. That's okay. I think we'll skip the video, Tim. I've run a little bit long. So, go to my God, as we say in Ireland, and thank you very much for your time.
Thank you.